successful lives.
Was there a moment that you realized this? That there's a connection to eating healthy, and we're spending all this money on healthcare, but we're not spending the resources there.
Yeah, I think I instinctively knew it kind of growing up that we were imbalanced in that way, because a lot of the diseases that I mentioned were very present in my family. I have grandmothers who passed away from cancer. I have a grandmother who had diabetes. Those kind of acute illnesses and disorders have been very present in my own family experience. So I certainly kind of pull from my own lived experience when I think about policy. But the moment that I realized that this very simple thing of if you spend $1 on prevention, it saves you $10 in terms of intervention and acute care, really came to me when I started to look at California's budget and how much we actually spend on healthcare. And I started to look at what the average Californian is spending on their healthcare. And I also recognized and learned that we are all living, most of us have a lot of medical debt as well. In the nation, we have over $88 billion of medical debt, which is staggering and is something that really makes it impossible for us to make sure that we're providing the kind of healthcare system that doesn't require us to fall into debt in order to be able to be healthy.
And this debt is on consumers, individuals?
Individual consumers are suffering under the weight of medical debt. It is one of the most crushing things to think that I could, in order to be healthy, I have to take on this debt that, quite frankly, makes us unhealthy from a financial standpoint and from a sense of overall well-being.
So you mentioned there's $88 billion of medical debt. Are some people out there afraid of going to the doctor, going to the healthcare system because of the cost?
Absolutely. Like if you just think about human behavior, so I am feeling sick today. I have a fever and I know I should go to the doctor. But I know that if I go to the doctor, it might cost me, if I'm lucky, $35 for a copay to have a clinical visit. If I'm unlucky and I don't have insurance, it could cost me $350 to be able to see that doctor. And so what am I going to do? I'm probably just going to go to the drugstore, pop a couple of Advil, and hope for the best. And that's on the easier side of things. We see a lot of deferred care in terms of the decisions that people make because they know that it's going to be so incredibly expensive. I just was talking to a bunch of dentists, for instance. That's healthcare. How many times do we make a decision to, forego getting that cavity filled because we know it's going to be too expensive? And then what happens to that cavity? It turns into a root canal. And what happens when you have a root canal? You can literally have infection that goes into your blood system. So there are dire consequences to pushing off the basic things that we can do. And one of the root causes of that is that it's just too expensive for people to wrap their brains around making a choice to do that instead of something else that they absolutely need. And the average person is living with the weight of being financially burdened from not being able to have a healthy life and access to preventative care. That is in the exploration of both food as medicine and some of our early policies in this area. I start to look at what it would mean if we just refocused on prevention instead of acute care and intervention.